let us discuss about the types of radiation therapy. The types of radiation therapy is mainly of three types: teletherapy or external beam radiation, brachytherapy or internal radiation, and radiopharmaceuticals. So let us discuss in detail about teletherapy or external beam radiation in detail and its types. So external beam radiation, it is the most widely used type of radiation therapy, and this is using external beam radiation is using photon beams. These photon beams are coming from a machine called LINAC, which is kept outside the body and is focused on the cancer. It's like getting an X-ray, but it takes longer time. This external beam radiation is used to treat the large area cancers in the body, and it also can treat more than one area, such as main tumor and the nearby lymph nodes can be treated at same time. Usually, this external beam radiation is given daily over several weeks. It is given on outpatient basis, or it can be given in a treatment center or a clinic. In most cases, it affects the normal tissue as it passes on its way into and out of the body. There are some special ways to deliver the external beam radiation, or else we can say these are the types of external beam radiation. The first one is 3-dimensional conformal radiation therapy, that is 3D CRT. Here we are using an imaging scans pictures and special computers to map the location of the tumor very precisely in 3 dimensions. So here the patient will be fitted with a plastic mold or cast to keep the body part still during the treatment. So the radiation beams are matched to the shape of the tumor, and then the radiation will be delivered to the tumor from several directions. The benefit of this 3D CRT is the careful aiming of the radiation beam may help in reducing the radiation damage to the normal tissues and better fight the cancer by increasing the radiation dose to the tumor. Also, photon beams or particles like protons can be used in this way. The main drawback is that the 3D CRT is, it can be hard to see the full extent of some tumors in the imaging test, and only any part will not be seen, will not get treated with this therapy. Next type is intensity modulated radiation therapy, or IMRT. This is advanced form of external radiation therapy. As like in 3D CRT, here also we are using computer programs to precisely map the tumor in 3 dimensions. Only the difference is, along with the aiming of the photon beams from the several directions, the intensity of the radiation or the strength of the radiation beam can also be adjusted in this type of radiation therapy. This IMRT, this gives even more control over the dose by decreasing the radiation reaching the sensitive normal tissue while delivering higher doses to the tumor cells. Because of this precision, it's even more important that the person should be kept still during the treatment. So for that one, we are using a special cast or mold which is made to keep the patient body in place, or keep the patient still during the duration of treatment. Next type is the image guided radiation therapy. So this is a newer radiation machine that have imaging scanners built into the machines. So the doctor will take the pictures of the tumor and make minor aiming adjustment just before giving the radiation treatment. So this will help to deliver the radiation even more precisely comparing with the other two types we discussed. It might result in fewer side effects, but more researchers needed to be prove this effectiveness of this IGRT. Next is intensity modulated proton therapy, IMPT. Here we are using proton beams instead of photon beams. Still we have no such studies which shows that a photon beam radiation is better than the common photon beams, and also regarding the side effects. But in 2012, A study of photon beam therapy is has been conducted to treat the prostate cancer. But still, IMPT is often used for treating some tumors near to the critical body structures like eye, brain and the spine. Next type is the stereostatic radiosurgery, SRS, and fractioned stereostatic radiotherapy. Here we are delivering a large precise dose radiation to a small well-defined tumor. This is used to treat the tumors that start in or spread into the brain or head and neck region. If the radiation is given as a single dose, it is called stereostatic radiosurgery. When the radiation is spread out over several doses, that is when you are fractioning or when you are dividing the doses, the whole dose into small doses, that is called as fractioned stereostatic radiotherapy. Then stereotactic body radiation therapy, SBRT. SBRT is used for tumors in other parts of the body, for instance like in case of spine, liver, pancreas, kidney, lung and prostate. Once the tumor is mapped using the imaging scans, a narrow radiation beam will be emitted from the machine, which is called as gamma knife. And this beam will be focused at the tumor from hundreds of different angles for a short time. Next is the intraoperative radiation therapy or IORT. IORT can be given either as external beam radiation or internal beam radiation. So radiation is given when during the surgery using a machine for external beam radiation, like using a LINAC. We are giving a radiation during the surgery. That is considered as external IORT. If a radioactive substance is put into the treatment area for a short time, it can be considered as a brachytherapy. So IORT given used along with the course of external radiation therapy before or after the operation. Usually we are going for an external radiation in case of IORT. IORT is useful for cancers deep inside the body because normal tissues can be moved during the surgery by exposing the cancer tissues. So in coming to the IORT procedure, the tumor will be removed from the site. Then a balloon applicator is placed into the cavity. Then after that, the radiation treatment is delivered around 8 minutes. Then after the duration, this balloon will be removed and the cavity will be closed. This is what happening in IORT. So IORT is given in a special operating room which has to be lined with the radiation shielding walls because the radiation should not emit or should not go outside the operating room. It is hazardous. Also, the IORT is most often used for abdominal or pelvic cancers that cannot be completely removed. Also, there are cancers that are very close to the vital body parts, and for cancers that tend to grow back after the treatment. Next one is the electromagnetic guided radiation therapy. It uses a tiny electromagnetic implants. They are called as transponders. They are placed into the area being treated. These implants will send out radio waves to tell the radiation therapy machines where to aim. So these transponders will send out the radiation waves. These radiation waves will be captured by the radiotherapy machine. So this will let the machine to compensate for movement, like during breathing and all. If there will be movement, it will be there. So even if there are movement, this machine can identify, or machine can aim the transponders, and it may help to keep some of the radiation from going to the normal tissues. It also helps for refocus the radiation beams as organs shift or cancer shrinks over time. So when the transponders are in place, after a period of radiation therapy, the cancer may get, size may get reduced. Even in that condition also, we can refocus the radiation beams, or we can refocus that by using the transponders. So this is sometimes known as 4D therapy. Next is about the dosing and treatment with the external beam radiation. The total amount of radiation the patient will get is measured in units called gray. Often the dose is expressed in centigrade, which is 1/100th of a gray. For external radiation, the total dose is often divided into smaller doses. They are called as fractions that are typically given over a number of weeks. This allows the best dose to be given with the least damage to normal tissues. So the external the radiation treatment will usually given in 5 days a week and will last for around 5 to 8 weeks. Then coming to the some special classification of dosages like hyperfractionated. In this type of dosages, we divide the daily dose into 2 treatment sessions without changing the length of the treatment. Then next is the accelerated radiation. Here we are giving the total dose of radiation over a shorter period of time. So giving more frequent doses, more than once a day, to get the same total dose of radiation in a day, and it may shorten the course of treatment by a week or 2. Next is hypofractionated doses. Here we are breaking the radiation into fewer doses so that each dose is larger. Sometimes this could mean it's given less often than once a day. So we are dividing the dose into fewer doses and the dose will be larger. Sometimes in some days the patient will not get any treatment. So this is about the dosages of external beam radiation therapy.